Good afternoon, everyone, and welcome to NMQF's LinkedIn Live. I'm Victor Mejia Lacayo with the National Minority Quality Forum, and thank you so much for joining us for today's important conversation from data to action, turning SPD 15 insights into state level solutions. We're here today to talk about why health data matters. When communities are invisible in the data, they get left out of healthcare solutions. Our guests today are from the Data Equity Coalition, and they're sharing a new toolkit designed to improve how we collect race, ethnicity, and disability data. They're going to dive into how better data can actually fix healthcare systems, improve mental health, and deliver resources to communities that need them most. We're excited to have Courtney Lang moderating today's conversation along an incredible panel. As always, we encourage everyone joining us live to participate in the conversation. Please drop your questions and comments in the chat throughout the discussion and share this live stream with your networks. And now, without further ado, I'd like to turn it over to the moderator, Courtney Lang.
Welcome, everyone, to our LinkedIn Live session. We are turning data into action, and we are talking about Statistical Policy Directive 15 and why the Data Equity Coalition is so important to each one of you in the audience. We want to begin at the beginning, and that is the Data Equity Coalition was formed in 2002 as a joint convening between the National Minority Quality Forum and Blue Cross Blue Shield Association. Today, we have over 30 stakeholders that have assembled together to advance standards on race and ethnicity, sexual orientation, gender identity, disability, and language. And we are most grateful for our coalition members. Today, we also want to extend a thank you to Gretchen Wortman, who leads the Center for Public Policy and Programs, as well as Dr. Gary Puckrin, founder and CEO of the National Minority Quality Forum, for hosting this platform for this discussion. I would like to begin with our panelists who are going to bring great knowledge and great conversation to this dialogue. Aishat Magbade, Legislative and Regulatory Policy, Community Health Policy, Blue Cross Blue Shield Association. Joyce Liu, Policy Analyst, Asian Pacific Islander American Health Forum, as well as Caren Howard, who leads the Senior Director of Federal Advocacy for Mental Health America. And so without further ado, we want to kind of set the stage a little bit and dive into the conversation, why we're here, why SPD 15, what does that mean, why we should know about it, and how communities can stay engaged, not just at the federal level, but looking to state level action. So with that, Aishat, I'm going to turn the floor over to you to give a little context for the conversation, to set the groundwork for what we're going to talk about here today.
In March 2024, OMB updated Statistical Policy number 15 for the first time in 30 years. As part of this revision, SPD 15 combined the race and ethnicity question. Previous standards, which collected race and ethnicity across two questions, made people believe that there was only one ethnicity. These new standards highlight that there are multiple ethnicities and allow for more accurate self-reported data collection and data disaggregation. These new standards also allow the ability to write in your ethnicity. Seeing these expanded ethnicities beyond Hispanic have allowed the ability to write in your ethnicity, which allows for more accurate self-reported data collection and data disaggregation. These standards also included the new category, Middle Eastern and North African. This MENA category was previously within the white category in the data standards. Separating this population from white allows for more accurate data collection and allows them to be more visible within data collection. Data disaggregation refers to the process of breaking down aggregated data into smaller, more specific groups to reveal patterns and disparities that may be hidden within a larger data set. This is really important to allow populations that have been historically hidden within data to be seen and fully represented in data collection practices. By separating them out into smaller units, this helps us to see underlying trends that were traditionally hidden to make more informed data decisions based on the data that's been collected. And through this toolkit that was recently launched by the Data Equity Coalition, we are allowing this to be collected on the state level, aligning state level data collection practices with the federal government, so that by 2029, state level data collection practices will align with federal data collection practices to ensure that data sharing between state and federal governments will be more aligned, which will help with closing any data collection gaps or data sharing gaps that may happen if state level data collection is not aligned with federal level data collection.
Thank you. Thank you, Aishat. We're going to turn the floor over to Caren Howard. And before I do, Caren, we want to acknowledge that May is Mental Health Awareness Month. And so we are particularly grateful for all of the work that Mental Health America is doing and has historically done to advance the mental health movement. So without further ado, Caren.
Thank you so much, Courtney and Aishat. Again, this is Caren with Mental Health America, and our May is Mental Health Awareness Month was established in 1949. So we've been celebrating over 70 years and are excited to ensure that while we're discussing mental health and awareness of mental health, we also include in that discussion data. The May is Mental Health resolution will soon be introduced by Congresswoman Salinas of Oregon and her co-chairs of the Mental Health Caucus, and it will describe the state of mental health in America in numbers. However, as Aishat discussed earlier, data by numbers doesn't always tell the full picture unless it is inclusive of very specific identifiers of that data. So in our Data Equity Coalition brief, Mental Health America worked with the Data Equity Coalition to describe how SPD 15 can be further implemented through states and providers to ensure that when we are collecting information about an individual's demographics, we also include their race, ethnicity, disability status, and other factors. All of these indicators allow us to paint a more clear picture of who is receiving services, who needs services, and where services are lacking. And if one thing out of the COVID pandemic we learned, it's that certain people had very easy access to care and access to early vaccinations, and other people did not. And reaching those other folks and bringing them into the healthcare system took some really creative strategy. But finding who wasn't having access or who didn't have access to care really came down to having good data. The brief that we that I mentioned here that we worked on with the Data Equity Coalition describes several bills that lay out and enumerate what rights individuals have in America, including those with disabilities. And if we are only serving individuals without disabilities or individuals that fall into another certain demographic, then we are not really truly offering everyone the opportunity for life, liberty, and happiness in the way that our Constitution guarantees. As we think about the delivery of behavioral health services, although HR 1 cut Medicaid funds. There have been funds for CCBHCs, which are popular with voters. A survey came out this week showing that certified community behavioral health clinics were supported by over 90% of the population of voters surveyed. And these clinics really have a special model of care. They're led by interdisciplinary teams and offer behavioral health services in the community to folks with Medicaid and private insurance. However, the states that are standing up these models have to determine, okay, well, where are these services needed? And if you're only putting new CCBHCs in places where people already have services, then you're not further serving and expanding access to this really good care that's proven effective. So as states, rely on data to determine the locations of new facilities and where to invest in work funding to grow a workforce, and how they should be working with private partners to grow health systems. Data about who has access and who is marginally underserved on a regular basis helps states to know how best to meet folks where they are through new developments and capital construction.
We love meeting people where they are, Caren, and that's exactly what your work at MHA helps to do and helps to deliver. So for that and all of the advocacy on behalf of so many people that are unable to advocate for themselves, we say thank you, and we owe you a debt of gratitude. Joyce, I would be remiss if we also did not acknowledge that May is Asian American, Native Hawaiian, and Pacific Islander Heritage Month. And so we want to make sure that we're acknowledging the full spectrum of representation that comprises the race and ethnicity advocacy that we've been doing on behalf of the Data Equity Coalition. So both Aishat and Caren alluded to some of the data disaggregation and intersectionality work, but was thinking that you might be able to add a little bit of context on why is data disaggregation so important to the audience that's watching this right now.
Yeah, thank you so much. And also happy ANHPI Heritage Month and Mental Health Awareness Month. May is a big month for all the celebrations and recognition. And I think that's kind of key to why we're here today is the recognition and be able to be seen in community and outside of it. So the Asian and Pacific Islander American Health Forum was founded 40 years ago to address the lack of disaggregated data in the Asian American, Native Hawaiian, and Pacific Islander communities. So during that time, HHS had a groundbreaking report called the Heckler Report, where it really was the first time HHS looked at how the health outcomes affect communities of color. However, in this report, it stated that Asian Americans were healthier than other people of color. And really that goes to the lack of data and lack of understanding in the greater diaspora. Because the aggregate data for Asian Americans were like really stellar results, it masks the unique health needs within the community. It masks that the Asian American, Native Hawaiian, Pacific Islander diaspora runs over 60 countries. Like it's very, very broad. So our organization was actually founded because of data and specifically how data is critical to health for communities. And going back to SPD 15, we know how important it is to make sure that our data is up to date and reflective of all communities in the country. In 1997, there was an update where it would separate the Asian American and Native Hawaiian Pacific Islander groups into two unique racial groups to address the needs in the aggregate. And the 2000 census was actually the first census that reflected this. So in 2024, when there was the update again, we were all in terms of talking about the necessity of having groups where people, when they are filling out the census, can feel seen. I know for our MENA colleagues, they're very, very thrilled to be able to be seen for the first time. And really, when you are counted correctly, there are resources that might not have been available to you before that you are able to access now. So talking a bit about some of the benefits is really that data is a foundation of everything that we do, everywhere from clinical trials to healthcare enrollment to really the amount of resources that our communities receive. Just some numbers off the top of my head for clinical trials, that the Asian American aggregate for cancer rates seem low. However, that East Asians are 13 times more likely to get gastric cancer than their white counterparts. Same for Hep B, same for diabetes. You can go on and on about chronic conditions and diseases that affect specific ethnic groups that you might not really see in the aggregate. And in terms of funding, a total of like about less than 0.2% of NIH funding actually go toward specific research toward the entire Asian American, Native Hawaiian, Pacific Islander diaspora. So think about how many different ethnic groups have really had their health care overlooked due to the lack of resources. In terms of healthcare enrollment, one of our favorite examples is in 2013, about 13% of the aggregate Asian American, Native Hawaiian, Pacific Islander communities were uninsured. However, there were 10 distinct ethnic categories that had uninsurance of over 20%. So when we were able to disaggregate the data and we look at which ethnic groups were uninsured, we had a better idea of how to address this. So, for example, Korean Americans, there were 21% uninsurance in that community. We were able to go to Korean American small businesses, to churches, meeting our communities where they're at. And then in 2023, the number of uninsured Asian Americans went down to 5.3%, and the number of uninsured Koreans went down to 6.6%. So it is stories like this where you can really see the power of data and how we can utilize it, not just within our communities, but with the healthcare ecosystem as a whole.
Well, we appreciate the storytelling because honestly, that's why we're assembled here today. We're here to tell the story, not only on behalf of the communities that we represent, but also on behalf of ourselves. So we are the reflection of what it means to be seen in the data. And we want to encourage every single viewer to make sure that you don't shy away from completing those healthcare data surveys and intake forms. We need that. It's curative, it provides access, and therefore care is being able to deliver at the community level. Aishat, what was it now, about a month ago? State Advocacy Toolkit, groundbreaking news, hot off the press, just released. Tell the audience, why is this so phenomenal for states?
It's actually really important for states to align with these new federal guidelines because states and the federal government share data all the time. So if the federal government is collecting data in one way and states are collecting data in a different way, when they start sharing data, it's going to be mismatched. And that's going to make data sharing very complex. And there's going to be gaps in the data that's collected, which can actually make a lot of things complex, complicated. Data will be missing, there will be gaps in data, and we will start to lag behind in what data is actually being collected and shared. So it's really important that state level data starts to become aligned with where the federal government is going. So between now and 2029, when the federal government starts to implement SPD 15, it will be really important for states to update their own data collection practices with SPD 15. So the toolkit includes a number of different resources that stakeholders can use on the state level to ensure that states get to that place by 2029. For example, the state toolkit includes model legislative texts that stakeholders can use to share with state legislators to align their data collection practices with SPD 15. It includes legislative text and drafting notes that they could use to introduce a bill to codify their data collection practices to align with SPD 15. It also includes talking points that stakeholders could use when they do have meetings with state legislatures to talk about why it is important to align their state level data collection practices with SPD 15. It also includes one-pagers that they could use, as well as talking points that they can use with other stakeholders within the healthcare system to talk about why it's important for them to talk about these issues with when they start forming their own state level advocacy strategies about why it's important to align with them. And then most importantly, there are talking points and one pages for the community. So when they do talk to the people that they serve or the communities that they serve about why it's important to align with SPD 15 or why SPD 15 impacts them, they have those resources there. And the resources for the community level are written on a third grade reading level, so it's very easy to talk to them about them and easy for them to understand why SPD 15 is important to them and how it impacts their daily lives. So if you've ever filled out a form, if you've ever filled out a job application and you've written down your race or ethnicity, that is SPD 15. So it's very easy to talk about how it impacts you and how it shows up in your daily life and why you should talk to your state legislator or your county representative or your mayor about why SPD 15 is important to you and why your state legislature should align their data collection practices with the federal government to ensure that all levels of government are collecting race and ethnicity data in the same way so that all levels of government are considering you and your community in laws, regulations, and other ways that impact your daily life. So that is why the toolkit is really important. And that's why we're hoping that you and other stakeholders go online and look at the toolkit, read through it, and use it in your own daily life and your own advocacy to ensure that data collection practices include you, your community, your families, and your friends.
Thank you. So it's dataequitycoalition.com. Go under state resources. There it is. It's the State Advocacy Toolkit. Aishat highlighted the model legislation, model resolution, community talking points, health literacy at its best. Caren, I know we've been talking a lot about SPD 15 because of the grounding in race and ethnicity, but our coalition does more advocacy beyond the minimum. So SPD 15 covers race and ethnicity. We've connected federal and state, but why is data standards important in communities broadly, not just looking through just the lens of race and ethnicity, but through SOGI, disability, and language as well?
Sorry there. I was not prepared. Thanks so much for the question, Courtney. You know, our communities are various. America is a melting pot. We have folks from all different countries, folks from different backgrounds, individuals who have disabilities, whether intellectual, psychiatric, physical, mobility related, and ensuring that all of these differences and unique parts of our identities are collected and considered in data assessment is important for resource allocation. Already, Countries are using artificial intelligence to determine how investments are going to be spent at the national level to address the needs of the community. And so if our data does not reflect, at the state level and the federal level, the gender identity and sexual orientation, as well as the disability status of the full population, then somehow we're leaving folks out. And
Right.
in the mental health space in particular, we know that due to societal and sometimes familial and cultural sensitivities, not everyone really has a warm, welcoming, and supportive environment to
Right.
grow and make mistakes and live their life in.
Yes.
And so mental health and behavioral health care is especially important for those who are LGBTQ plus and those who have disability status or are racially or ethnically minoritized because of those societal factors. And so we need care that is responsive to them in particular, and we need data to ensure that our resource allocation and that our assessments of outcomes really reflects really specific and measurable numbers that can be changed and addressed when inconsistencies or misalignments arise.
Yeah.
For instance, before the Americans with Disabilities Act was implemented, there really were no ways for individuals in wheelchairs to get up and down sidewalks. And how does that impact their mobility or ability to even get to a doctor's appointment or go to the grocery store? They would have to rely on, a street or a road and competing with a vehicle. So that's not the ideal quality of life that we expect for our individuals here in the 21st century. And designing and planning what lifestyles look like, what our communities and cities look like, and how our health systems respond is really going to be based on user feedback from the most marginalized populations that must be reflected in data.
Thank you so much for that, because it's such an important aspect to highlight, and that's the intersectional identity that your white paper, MHADC's collaboration, brought to light. And Joyce, with that, I'm just kind of doing a little bit of a build. We have all of the work at the federal level, and Aishat has covered the State Advocacy Toolkit. Why is state advocacy so important to the broader movement around data disaggregation?
Yes, definitely. I think one of the big items we have talked about and advocated for are the federal data standards, and which it does have a trickle down effect a lot of times, not just to state and local governments, many of which have done incredible work to improve upon not just taking it upon themselves to match federal data standards, but places like California, New York, which have gone above and beyond to implement these standards across all agencies, not just the bare minimum, and not just collecting data, but actually utilizing the data to better improve their constituencies' lives, whether it's more translated materials, additional forms, so people understand how to access these state and local services. So really, I think when we think about data, we do have to think beyond the federal data standards. And also, I also challenge the ecosystem beyond just government, but also like providers, insurers, manufacturers, to collect accurate representative data across the board, because it not only saves money really to not unnecessarily waste dollars that's not working for all communities, but also it saves lives, like knowing that a certain patient might be facing adverse effects because they have a more holistic view of their needs. Building a bit off of what Caren has said, as our really our country shifts our reliance more on AI and automation, accurate data is more important than ever. That like the algorithms are based almost entirely off of data, and so if it is not representative, if it's not comprehensive, then many communities like ours will be left behind. And it's not to say that the algorithms are like inherently biased, but it's really to make sure that all communities, including rural communities, which have not been really included in a lot of these testing, in a lot of these algorithms, are not left behind, that what we use AI for actually works. And that is something that people actually have access to, that they're able to receive the health care that they really deserve. And I have to be remiss if I didn't talk about the National Academy's Unequal Treatments Report, which was from 2003, which really addressed the lack of uniform or comprehensive data on race and ethnicity, because the healthcare industry is so data-driven, and decisions that are made in a clinical setting rely on comprehensive data that's representative.
So we don't want anyone to feel disconnected from the data. And I love that point, Joyce, because it's not just about being seen, but it's about understanding how the data saves lives. I love that. It's a very, very powerful statement. And as we kind of round out this LinkedIn Live session, Aishat, I'm just going to give you the first opportunity to have the final thought. So this is the first opportunity for a final thought. What should the audience take away? Bar none, hands down, what's happening? There it is.
I think the audience should take away that data standards truly do matter. Without data standards, we can't do anything. Data standards are truly foundational to addressing disparities. And if we don't have the data, we cannot understand where the disparities lie. We can't understand where the gaps are. And if we can't understand where the gaps are, we truly cannot address them. So having the standards are truly important to addressing the disparities that exist and getting us towards achieving them, achieving health equity and eliminating disparities. So that's something that we truly have to address. So without the standards, we cannot get to where we want to go.
Thank you so much. And that's why we want everyone to download the State Advocacy Toolkit, because it helps to connect the dots between the federal and the state and allows you to take action. Joyce, final thought for the audience.
Really, that advocacy does not begin or end with this LinkedIn Live, that to really continue to hold not just your elected officials accountable, but also everyone around you and your ecosystem, like accountable, like saying that data, especially representative data, is important, and also fill out all those surveys, fill out the census. It's you have the power to make yourself seen and heard. So really fill out your census.
Love that. You have the power to be seen and heard through you. Caren, final thought for the audience.
I will just share that while we all want to be seen as equals, we have a really important role in advocating and in raising our voice. We might not feel empowered, like we're going to make a difference, but with the toolkit, you have a lot of resources to know how to reach out to your state representative to talk about just the fact that you are important and you are seen. And in your advocacy, not only is data important, but your story is important. So when I think next iteration of the toolkit comes out with all the legislative sessions for 2027, you can get prepared now to ensure that your legislators go into 2027 with your story and with data using that toolkit, and that makes sure that you're seen, you're heard, and you're included in decision making.
I love that. This is just the beginning, right, friends? So we have moved and we have mobilized. And this is really the power of the toolkit, the state advocacy work, grounding state legislative activism, county, local, connecting the dots to the federal movement. The Data Equity Coalition is multidisciplinary in that patient groups, provider associations, civic and social justice organizations have all come together with one common commitment and cause to advance data standards in a responsible way, to hold that integrity accountable for OMB's SPD 15 update on race and ethnicity, but to exceed beyond the minimum so that geography, language, disability, sexual orientation, and gender identity is considered a part of the broader tapestry. So we are so grateful to the National Minority Quality Forum, as well as Blue Cross Blue Shield Association convening together to bring this platform to light. And Courtney Langco and Partners, a health justice advocate, thanks you so much for allowing me to take the privilege to moderate this session. And once again, for Dr. Gary Puckrin's foresight so many decades ago to make sure that data was illuminated as the true platform to allow us to have equity in care. Thank you so much, friends. Have a great day. DataEquityCoalition.com. Signing off, LinkedIn Live.